Hello, it's Professor Stephen Twigg here with Associate Professor Marg McGill, and we're two of the lead researchers from the academic perspective and clinical perspective in the type 1 diabetes and exercise study, linked in with the University of Sydney, Royal Prince Alfred Hospital, and also going on to the type 1 diabetes exercise site, which is going to be tested as per Alan Bolton's. Well, hello. A couple of years ago we were in the very same room discussing the challenges of type 1 diabetes and exercise, and Marg, in particular, the challenges related to low blood glucose levels that can be induced by exercise in people with type 1 diabetes.
That's right, Stephen, and the thing is that these low blood glucose levels often frighten people away from exercising, and that's exactly what we don't want them to be. We don't want them frightened to exercise. They need to have ways which help them so that they can integrate exercise into their lifestyle without any bad side effects.
Yes, certainly. And the challenges at that time were that there were some broad international guidelines which instructed around type 1 diabetes and exercise, but there were very few user-friendly tools which were out in the marketplace, out in the real world, and typically those tools and recommendations had not been tested. So at that time, working away addressing the exT1D website.com.au, formulated by Mr. Alan Bolton, we formally tested whether a randomized controlled trial intervening in type 1 diabetes and exercise, utilising that website, might be able to improve glucose outcomes in people, Marg, who undertake exercise.
That's right, and it was a very well conducted study, very rigorous, approved by the ethics of University of Sydney and Royal Prince Alfred Hospital, and has now been completed.
Yes, and we had a PhD student supervised by myself and Marg, and this student undertook this randomised controlled trial of people who were undertaking some regular exercise. We looked at their baseline rates of hypoglycaemia in particular, and the study question asked was whether once they had engaged with the package of the exT1D online and utilised that package, whether or not the hypoglycaemia number and the hypoglycaemia duration related to exercise might be able to improve. And impressively, the data demonstrated in the randomised controlled trial part that there was an approximate halving of the number and duration of episodes of hypoglycaemia related to exercise in the intervention group.
And that's a fantastic result, Steve, because if you've got diabetes, every hypo is a nuisance. And if you can halve something by 50, or halve it, it's amazing. Yes,
and in particular, Marg, they went from memory often, 6 or more exercise-related hypos a week and reducing that markedly, really making a clinically significant difference and an improvement in what we believe is the quality of life. We saw that in some of the surveys undertaken. There was greater confidence to exercise. The people who utilised the website felt that they were more in control related to exercise, having type 1 diabetes and safely exercising. And now the study itself became more clear, statistically significantly clear, in the longitudinal follow-up. And what we did here was, in the 32 subjects, about half of them were initially randomised to the intervention and the other half continued with their usual care. But after that first 5-week block, those then who were in the control group in their usual care also then had access to the exT1D site. And typically what we found then is that that group had clear improvement also in their hypoglycaemia. So in the longitudinal study, there were statistically significant improvements, and we would link that to clinically significant improvements, Marg, again in hypoglycaemia number and hypoglycaemia duration.
But there was also more than just that as well, Steve, because I had patients say to me, for the first time, having looked at that website, I truly understand about glycogen storage and the need to eat for performance and the need to manipulate my blood glucose levels more than I did before. And it's proven in the study.
Exactly, Marg. The website is a package. It has a modular approach, a number of educational components to it. And as you were just saying, there are some parts that help people understand what happens with handling of glucose by the body with exercise. And then there are some other very important modules about tools that people can use with type 1 diabetes to minimise the risk of hypoglycaemia and help stabilise their glucose. And many people with type 1 diabetes and their relatives would be aware that the low glucose levels can occur often shortly after exercise, sometimes during, but often within hours afterwards, and then also the next evening. So there's this dangerous nocturnal hypoglycaemia and also the daytime hypoglycaemia after the exercise. And the modules help in the appreciation of that, why that occurs. As you were saying, the body depletes glycogen and there needs to be a replenishment of that with carbohydrate intake, particularly after the exercise. And related to that is, with the tools, is what can be done with carb intake, with adjusting insulin therapy, with considering blood glucose monitoring frequency, with respect to the time of the day that a person might better be able to exercise, as well as all those issues of type, intensity, duration of exercise. So the total package, Marg.
Yeah, and I think, and the final outcome for many of those patients who underwent that study, they said that they felt more confident to exercise and they felt more safe to exercise. And I think they're really, really important points. As well as the blood glucose levels being managed, it's also important for people's psyche that they feel confident and happy to exercise.
Thanks. So Mr. Alan Bolton came to us quite a number of years ago now with some very positive anecdotal reports of people that had utilised exT1D.com.au and found that it benefited them, that it helped them clearly with respect to exercising in type 1 diabetes, having that confidence, that safety feeling, and being prepared to undertake what are normal recommendations for people in the general community and what they should do with exercise. And now we have the further evidence of the randomised controlled trial and the improvement in outcomes. We've presented this work in collaboration with our PhD student Agata Piotrowicz at national meetings, at international meetings, and it's been well received. We're going through processes at the moment of aiming for a high impact international peer reviewed journal to publish the work. And we think it provides an excellent foundation to support the concept that educational tools in people with type 1 diabetes can be very helpful also in that exercise space.
Absolutely. So I think it's a really important initiative, and it really is going to help people not only in Australia with type 1 diabetes but around the world.
So whilst there are some other packages for type 1 diabetes for people who exercise, a lot of those have not been rigorously tested. They haven't undergone the randomised controlled trial process, studies which are challenging to do. And we believe ultimately that there'll be complementary approaches. There are a number of guidelines internationally. There are some bodies which are recommending approaches for people with type 1 diabetes. And not surprisingly, key elements of the package in exT1D do overlap nicely with those other tools, and ultimately we'll probably get further unification in the field. In the meantime, this particular tool, we believe, has delivered.
I agree.